AIDS is a chronic infectious disease, which means that we will always have problems with resistances. And that is what happens in developed countries, in Europe. After some years in therapy, patients need to switch to a second-line treatment, what we call a second-line treatment, basically because they failed to the first line. There are resistances. This we begin to see also in developing countries in MSF projects. That is the main challenge we be facing now in AIDS. These drugs that you need to switch to when you have a failure are normally the newest drugs. They are threatened by patents, and therefore generic competitors do not enter in the market. There is no competition and prices remain very high. In fact, these new drugs needed for treating second line on AIDS patients are up to 14 times more expensive than the first line drugs. So the main challenges, answering your question, are price and availability. Also because there are very little competition due to this threat of patents, the drugs are not really available in the countries where we work.